Welcome everybody to the Tuesday, May 16th meeting of the Macon County Health Department Board of Health. Time is 5:33. And so I call the meeting to order. Roll call, please.
Mark Scranton.
Here.
Jeff Emmett.
Here.
Randy Clevenger. Here. Carolyn Wagner.
Here.
Jan Hack.
Here.
Debbie Hill. Dr. Jerger.
Here.
Dr. Meningati. Cody Parks. Dr. Smith.
Here.
And Marcia Webb.
Okay, please rise and join me in pledge allegiance. I pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Make a motion to approve the agenda topics. So moved. Second. All those in favor?
Aye.
All those nay? Okay, motion carried. Public comment. Lindsay, do we have any public comments at this time?
Yes, we do, and feel free to stand up here if you'd like to. We've got 3 minutes.
Hi, my name is Abir Motian. It's nice to see all of you and meet all of you, or most of you. But I'm here because the topic I wanted to focus on is the right to life. Okay, some people in clinics dispense medication left and right and don't care about how they dispense it. And then what happens is the innocent people, the non-addicts, the non-criminals, all they get is cars going around going bzzz, or you know how they can, and those people who are driving those vehicles, they gotta be crazy driving those vehicles, but they're used to it, so they're probably intoxicated on purpose so that they can be able to handle it. And a lot of it has to do with the dispensation, dispensing medication from doctors, nurses, nurse practitioners, and others. We, the people, we end up suffering. And then these people do business bothering people. They make money under a table bothering people by doctors. And why? Because doctors need body parts. There's too many people on transplant lists. And so the good people, the healthy people, we're the one who has to suffer. And then my name is Abir Motian. Who's Abir Motian? Well then, hey, well, okay. She don't smoke, she don't do drugs, she don't do all the things they do. Well, her name sounds foreign. Let's treat her like a refugee. Let's bother her. Maybe we can lure her to go to a clinic. That's why I have to go back and say that I would like to ask if you guys can do it more computerized, the dispensing of medication to people, especially narcotics, opioids, and stuff like that, because it's getting more popular than marijuana. Mixing it with fentanyl, methamphetamine crimes, shooting and stuff like that. I mean, drugs is a big, major problem, more than marijuana is. Marijuana is just the beginning, but then it goes way past cocaine, methamphetamine, heroin, and it's just they're inventing and creating different kinds of drugs. And it gets worse and worse. And so I was wondering if the health department can work with the street department, the roads, so that we can try to control the people and people can follow the law and everybody can be safe. You can be safe, first responders, authorities can be safe. People living in their homes can be safe. I mean, I'll be in the house, laying down, trying to go to sleep, and then all I hear is, and that goes through our bodies because it rumbles and it goes through the buildings.
Abir, I just want to let you know you're at 2:30, so you've got 30 seconds left.
Thank you. It goes through our bodies and it induces gases into us, and then people end up having what? Gas or farts or diarrhea because of what they do. And so I was wondering if you can help to stop this. And again, this is a complaint, really. It's really happening, and I would appreciate it. Thank you. Nice to meet you.
Thank you.
Thank you.
Thank you.
Anybody else for public comment?
No.
Do you have any correspondence, emails, or anything at all?
Nope.
Okay, all right. Okay, approval of previous minute meetings. We have the meeting minutes from April 18th. And also the closed meeting minutes that everybody should have got a copy of when they came in as well. And I need a motion to approve those.
I will make a motion to approve them.
Second. All those in favor?
Aye.
Any opposed? Motion carried. Communication, board education. You don't have anything under that?
Nope, nothing at this time.
All right. Presentation, acceptance of financial report. Lakia.
Alrighty, this report is through April of 2023. We are 41.66% into the year. The fund balance currently sits at 7.59 million. Total revenue so far has been 2.6 million, which is 36.2% of budgeted revenue. Expenditures are at 2.45 million, which is 27.3%. The money market account currently sits at $4,023,000, which is an increase of $9,238 since our last meeting. And then total interest on the checking account since last meeting has been $3,405. Any questions?
How much did you say the interest was?
For which one?
What you
The
just
money
said.
market?
Uh-huh.
The money market since last month, $9,200.
Interest?
Mm-hmm.
Thank you.
Okay, anybody got any other questions for Lakia on that? Make a motion to approve the financial report as presented.
Second.
All those in favor?
Aye.
Any opposed? Review and approval of department expenditures.
Approve the expenditures.
What's that?
I make a motion to approve the expenditures.
Okay, I will make a comment on this. I did appreciate the fact that I noticed Lindsay is initialing these. It's good. That means I know that you're looking this stuff over.
Thank you.
So that's helpful. Appreciate that. So we have a motion to approve the expenditures as presented.
I will second that.
Okay, all those in favor?
Aye.
Any opposed? Review of the CFO Board of Health Flex Time Report.
Yeah, I have a question. Under the WIC CPA, if this is similar, we look like we're at a balance of 61.25 hours.
We showed this last meeting, and what it is the first column is what's been accrued over the course of history, but she's currently using 44 hours of
Okay.
that and is actually under 10 hours of current flex time.
Is there a way we can?
So the system won't allow because the time hasn't passed yet. So once the time passes and that pay period is over, then it'll squeeze
That
out,
drops off.
but it won't drop off until then.
I'm sorry, I'm probably still gonna keep asking questions when they're that large, just to make sure.
It's just fine.
Thank you for explaining it.
Okay, anybody else have any questions on that? Okay, department division reports. Do any of the directors that are here have anything that they want to highlight in the reports or correspond to the board at all?
Because you're generally the one who has something.
They're all looking at me. I'm good.
I'm looking at all of you. You guys are all sitting together back there. I know Kim's back there.
Yeah, I was gonna say Kim's back there.
I'm in the kids' table.
Can't say it later.
I have a question for Rachel. Sure. When you're presenting a communicable disease report, there's a category of rabies, potential human exposure, and then it says confirmed cases. So One means that we had a confirmed human case.
That means that they're confirmed to have received preventative treatment due to a bite exposure. So that means that is someone that we said, yes,
Okay.
go ahead and go get that treatment.
Oh, okay.
Yes,
All
so, and then you'll also notice at the bottom of that column, there's actually 3 different categories. So there's cat and dog bite
I see that.
investigations.
I see.
So that number is usually the largest. And then it's broke down by people who we have kind of talked to and did a whole outline with, and then the people that we've said, you know what, you are someone who's appropriate to go get
You're at risk.
rabies, yes,
Because
vaccine.
you don't have a vaccination record.
Right, or your bite was provoked, particularly
Non-provoked.
if there's something that involves a wild animal versus your neighbor's dog that's up to date on vaccines.
Right.
You'll see an increase in that through the summer because it is now bat season.
Yeah.
So if someone has a bat in their home and they're asleep, they're automatically going into that category because their bites are so small that they can't detect.
Now, are we testing the people?
So we don't test people, but we do test animals. So if someone says, there's been a bat in my house, what we advise for them to do is, obviously, if the bat is alive, calling animal control. If they kill the bat, or the bat is dead, or we've had instances where someone's dog got a hold of the bat and, something like that, we want it to be dead, and then the animal control will come collect it, and we will actually ship that off to the state for testing. We've used that as a way to prevent rabies treatment because, as you obviously know, being a provider, it's not only is it expensive, but it's painful and it's a lot. So if we can test an animal and say you don't need this, we're gonna try to do that first.
Okay, thank you.
Yeah, you're welcome.
On that subject, did you guys see that there was a bat in Lake St. Louis that just tested positive recently for rabies? So,
We usually get
Yeah.
positives around here in bats. It's not uncommon.
Yeah.
So.
I could tell you personally, I came across 3 bats in the Lincoln Theater at different times. And one night, it was while we were in there working, it was pretty freaky to see something flying through the air. I've never seen one before. I didn't realize how small they are. They're not very big. So,
I think they're really
out there.
adorable as long as they're not touching me.
when I have it in a cup.
Nobody wants.
Flying in the sky away from me, we're
We had one
good.
lady flying one downstairs one night,
You were flipping out.
dead. She was not happy with that. So Ms. Wade, I have a couple questions for you.
Oh, I had a feeling that was
I
coming.
couldn't pass up the opportunity. This is good. This is a good thing, though.
Okay.
So I noticed in your report that you may have, or it appears that you may have, your issues with the digital reporting straightened out, and you guys started doing training as of like 10 days ago. Is that actually happening?
No, incorrect. So we do, yeah, we've got good news here. So, the all paid situation was taken care of. So that's ready to go. We are ready for our training. However, the day that we had our training scheduled and all of the inspectors had the day off, or not day off, but day unscheduled, the presenter got ill and had to cancel on us that morning. So we actually now have, training scheduled June 16th. So we will have 4 hours of training for the fielded staff June 16th.
So hopefully you can kind of give us some feedback on that next month then.
I hope so, yes.
Okay.
Yeah, and I hope, and I don't know if Evan's listening and if he wants to chime in, but maybe we can even show you like what the system looks like and kind of give you a demo of it too.
I'm hoping that you guys asked a lot of questions and make sure that you're getting what we're paying for.
Yeah, so one thing that, what we had already scheduled was that our training was on I think a Thursday or Friday, and we were gonna send 2 inspectors out Monday and Tuesday together to kind of work through an inspection together with the process. On Wednesday, have a meeting with Evan and I, and then Thursday, we have a meeting already scheduled with the digital team to go over stuff. And we will still have our weekly meetings with the digital team as we're going through, so if we see anything that needs to be corrected or fixed, we're handling it in a weekly matter instead of like letting it all build up and then trying to get it all taken care of.
And not to beat a dead horse, but what's the status of Popeyes?
You got me?
Okay, so you know as much as the rest of us, which is
Correct.
nothing.
Correct.
Is there any activity there?
I don't know. I've been by there. It doesn't look like there's anything going on to me.
I mean, the back door's still open. I mean, if you wanna go in, you can go in. The back door's been open for, I don't know, months.
Yeah.
I mean, it's probably been open for 6 to 8 months. It's just, I mean, I know we've had some employees that have driven by and we have squatters in there. The last time, Mr. Ali was here, I did let him know that the back door was open and that there were possible squatters in there. And he didn't seem concerned about that at all.
Yeah, I really question it. And then they have some issues in like Sangamon County and McLean County.
Sangamon County did close one of their facilities recently too.
And that's not the first time that that's happened.
Correct, yeah, they've closed, I think, both of their facilities in the last year there.
Just for satisfaction of the board, since we agreed to them being afforded the opportunity to do this, I would request that you send them an email and tell them that by next month, we want something in writing specifically what they have accomplished to date.
I sent him and the person that he gave me the name of, who was supposed to be their general manager of this area, I send them emails monthly and I'm not getting any responses,
Nothing at all.
nothing.
So where does that leave us at then? I mean, basically, there's really nothing that we can do until they say, hey, here's our papers, come look at
So
it.
we, in March, I think it was in March, we did the first set of plan reviews. They have not sent in an application, they have not sent in a menu. The architecture asked or answered as many of the questions as she could. And even in that letter, I said there will be additional stipulations that Popeyes will have to sign off on, similar to what we did with Wits. And the architecture said, I can't sign off on that, I don't want to, that's not my portion of it, which I get, they're just there for the plans. And then I made sure to CC Mr. Ali and Ms. Tasha, every single correspondence I did with the architecture and, even asking questions about, it's getting close to summer months, how are we progressing? And I'm not getting any response. I will also tell you that 2 other health departments have told me that they've tried to call him and the phone number that we all have goes to, I don't even remember, it's some really weird place. It's not his phone number anymore. And they're responding, they're trying to get emails to him and he's not responding to them either. So I'm not sure what's going on. I mean, it's kind of like everybody's in a black hole right now with this one.
So as the health department's position, then should we just leave this set or should we send them a letter saying you've not complied with what you told us you were going to do? We've given you this much time, you're not responding, therefore we have no interest in moving forward with you. Is that overstepping our authority, I guess?
I think that's a good question for Mike to know what Mike says, but I also keep in mind that to my understanding from when you guys first approved it, there was a statement that he wasn't going to even open anyways until summertime. So, we still haven't hit summer quite yet. I mean, we're getting close to it.
I'm just wondering if they're actually putting the money in there. They said they're going to put it there with equipment and everything else.
I don't think they have. And, it might even be interesting to maybe reach out to the city of Decatur to see if they've done anything with the city yet either. I know at one time I heard rumblings that like the shutters that they had on the building, like the city made them take them down. They were gonna issue a violation of something, I don't know. So
They're gone. They are gone.
are they?
They're not hanging askew any longer.
Okay. So maybe the rumblings were true on that one, but yeah, so I know, I really don't know what's going on with them and we're not the only health department that's not getting answers.
I think Mike needs to be asked that question, Mike. I think it's a good one.
Well, I think we need to draw a line in the sand and say, look, you came to us hat in hand and you pleaded with us to give you an opportunity to try to rectify this. You came and painted a great story and you've had this many months and we're not seeing any progress. You're not responding, you're not following up. And I mean, if they want to continue moving forward and spend the money, it's totally up to them because there's never going to be a assurance or guarantee that they're going to be allowed to open anyway. But at the same time, I just say, you know what, you guys are wasting your time because you haven't done what you told us you were going to do. That's my whole thing. I mean, I appreciate the fact that they wanted to come in and make an attempt to try to fix this and make it right. And the only reason I was even remotely considering the possibility of making this effort again is because, number one, they came and painted a really good picture of what their plans were, involvement in the community, and most importantly, the investment they were going to make into bringing that back up to, standards that it need to be at. And we're gonna have this as a training center and everything else, okay? So nothing you've told us so far has even happened at this point. And I don't want your staff wasting any more time with the situation if it's not gonna go anywhere. So I don't know, from a legal standpoint, I don't know what our obligation is as far as whether or not we should just send them a letter and saying, you can go ahead and do whatever you wanna go and do, but we're probably not gonna grant you a license. I mean, I don't know, maybe that's, yeah, I mean, I don't know, but they gave us a timeline that they were gonna get this done. So if they go past that, if they're not responding to phone calls and emails, I mean, if you're reaching out to them and you're not getting anything back from them, at some point, we gotta say, you know what, it sounds like you guys abandoned this project. Because we granted them the ability to do this, to go forward, so by the same token, I think we could retract that offer because they failed to do what they said they were gonna do.
Well, I will definitely send the two contacts I have at Popeyes. I'll send them an email first thing tomorrow morning just to see if I get anything. And then Lindsay, do you want to contact Mike to see what his thought is regarding the legal portion, or do you want me to?
I can reach out to him tomorrow. That's fine.
You said March was the last time you talked to him? Is that what you said?
March was the last time I talked to the architecture.
Oh, when's the last time you talked to anybody from the organization?
When was the last time he was here?
Yeah.
So it's been probably 5 or 6 months at least.
What was the timeline? Was there an end date of when they were gonna complete the
No,
work?
they just said it would take 9 to 12 months.
And this was back in December?
No, this was June. It was June, it was the June Board of Health meeting,
I'll say it's a
June of
little
last year,
Okay,
that they came to ask for approval.
okay. Yeah, I'll reach out to Mike and see, what our next steps should be. What we have the ability to do with health department.
I don't think we need to necessarily do anything at the same time. I think we need some kind of notification, say, you came and made this presentation, we gave you the ability to do it. We're a year down the road and we're not seeing any meaningful things done. And like Kathy said, the city may have some thoughts on it too, because if it's been going on for a year,
Okay,
they're only gonna get a license to do work for a certain period of time, right? I mean, they're gonna be given a window of time, and inspections have gotta be done at certain points, progress wise. I just don't want a building just sitting there, door being left open, people living in there. That doesn't sound like a renovation to me. It sounds like it's a bad environment. And the city may come, they have the authority to do it, we don't, the city does, but the city may go out there and look at it and say, you know what? We're gonna put a note on this door, this place is off limits, so.
I'll email the city too tomorrow and get an update from them, and then I'll be able to give you guys a better update.
Yeah, talk to Greenwell or whoever, and let's see if they pulled any permits and when they did.
I'll talk to David, and then I'll talk to their legal to see if they have anything going on with them, legal proceedings, like maybe an ordinance violation or something like that with them.
Okay, all right, thank you.
Kathy, may I ask you one other question?
Sure.
You have a pretty big training coming up here.
I
At
do.
the end of May. And
Super
you've
excited.
got other people from other health departments coming here.
Yep.
And you said that IDPH is maybe not going to be able to provide food or snacks for your guests.
Yes, because from we're still waiting for the approval for that, but according to what I've been told, the FEP grant, the Public Health Emergency Preparedness Grant, because this is only a 4-hour-long training, it's considered less than a half day, so food would not be able to be purchased. So she has actually sent my request, she meaning the state lady that I replied to, she has sent my request to the CDC, who has the final say-so, but the CDC is in the midst of their grant approval, so we may not get word back from that.
Do you need approval from us to be able to provide some refreshment to our guests who are attending?
Lindsay and Lakia worked on it, and I've got a budget of $300. We're
Okay,
gonna have
okay.
food and drinks and chocolate, we're good.
Okay, good, all right, I read this and I was like, oh, we can't,
Yeah, super excited about this
Planning to
training.
have like Jimmy John's or, something affordable, on site. And obviously we have a lot of people traveling in from close and even further distances, so the training runs from 9 to 1, and so we just, we just wanna offer something for lunch, so we have budgeted that in and are planning for that.
Super.
But thank you for offering for that, thank you.
Yes, thank you so much.
Okay, any other questions for
I've got a couple, Teresa, I noticed you,
All right.
I noticed that you did 3-month performance evaluations. Is that something that's done agency-wide?
Yes.
Is it?
Yes, we do 3, 6, and then they get back onto the annual rotation.
Gotcha, okay. I was curious about that.
Yeah, they have their 3-month evaluation and then their 6-month evaluation and their probationary period. So they're technically on probation, the beginning of their employment for their 6-month evaluation. Just to further add detail to that.
Gotcha. Kim, I noticed that the dental department had.
I think they had a good time before they started meeting. I like it.
I'm glad we're having fun. That's important. I noticed that the number of patients seen, it was substantially up. Is that just part of the time of year, or is
Yeah,
are
it
we
is.
freeing up from COVID?
Yes,
A little of both?
unfortunately, we have no rhyme, no reason when we're extremely busy and when we're not. Like today, we had tons of no-shows because school's getting ready to get out and they're having their final exams. So then like today's number's down, but normally, we are getting bombarded with school exams already, so we are booked fully to like middle of July just to get in for an exam. So,
You got everything you need? You're
well, I'm down an employee. So I need to get that ball rolling to get another employee. So, but we're gonna kind of offset the schedule a little bit, but we know with the school exams coming in, we gotta make room for them. So hopefully we got a good candidate, but we just gotta get the logistics going.
Thank you. One last observation, only 22 COVID vaccines last month.
Yeah, so numbers have been down. We did just get approval from, national level down for a second bivalent booster for those that are 65 and older or immunocompromised. So we did just recently start that where they have discontinued all monovalents, so that's your primary doses. Everything is bivalent based now. And they're looking to approve that second booster for everyone, but they've not given us a timeline on that. I would expect it would probably be sometime in the fall, closer to kind of our height of respiratory illness season. But that's kind of just speculation based on being on meetings.
Is it fact or fiction that there's a little bit of an outbreak in the nursing homes? I heard that from a nurse yesterday.
We have continuous nursing home outbreaks. There's not been a month where I don't have nursing home outbreaks. They are rolling. But a lot of times, I don't want to take up too much of your time. The more that we test, the more that we detect, which can be a good thing, but it can also work against us when it comes to trying to get out of an outbreak.
Yep.
So it's good to prevent actual outbreaks from happening, but we never get to that end cycle because we're continuously testing, so we're continuously getting positives. I'm sure Dr. Menegatti has a lot more to say.
How many of them are really sick? I mean, you're testing positive, but how many of them are really sick?
That's my point. Yeah, that's my point is, we have asymptomatic transmission that has happened through the duration of the pandemic, but it increases, outbreak numbers, and it might not truly be. What we've really honestly seen this season is respiratory illnesses from RSV and group A strep, highly, highly contagious and worse than what we've seen with COVID in this particular season.
Yeah, it has to be one of the others.
Yeah, it's always something.
Okay, I have one more thing. and I'll let Rachel answer this if she wants to, and Lindsay can chime in too. So the Keyharts were here last month and made a passion plea for us to look at being involved with doing some stuff for Lyme disease. Dr. Manigotti's here tonight, and so we had a couple come in here last month's meeting, and their daughter is suffering from Lyme disease, and she made a very passionate plea for the health department to get involved with some awareness and education and training, and they went so far as to offer to pay for tuition to send a physician from the area to go to a clinic in, I was looking at Philadelphia. Yeah. Become a Lyme literate doctor. Do you see that we have a need for something like that in Macon County? Because according to what she shared with us, there's literally nobody that is really familiar with dealing with that here in Macon County.
I had to go to Chicago to get mine treated. I've been dealing with all my life too. I went there last month, so there's there's a huge difference between a Lyme literate doctor and another doctor, because it's treated completely different, so.
It also depends, Mark, on what's the training and where they're trained. So if someone is trained somewhere where the Lyme is not that common, then they won't have access to the training, because I was trained in Long Island, where it's a Lyme hotbed. Lyme is actually from Connecticut. That's where the place, and that's where they have initially found 50 children with, they thought they had juvenile rheumatoid arthritis when they came up with the symptoms, and finally they found out it was the bug that was causing the problem. So, yeah, there are some controversies in treatment of Lyme disease and diagnostic problems, underreporting of cases, but Pennsylvania is one of the highest Lyme disease in the country. There are 14 states usually in the nation that has the 90% of the cases, and Illinois is not one of them, but I'm not saying that it's not here. It is here. And we as an infectious disease physician, when someone comes to me, yes, basing on my background in infectious disease and also having worked in Long Island for 6 years, I'm well aware of Lyme disease and the problems and how to approach it, how to treat it. But then there are other areas in Lyme disease where there are certain things we can treat, certain things we cannot treat, but then there is another set of alternative approach that comes into existence, like there's integrative medicine, that holistic medicine, and they come into play, and then they say we got to do things this way, which science and CDC sometimes do not back these things. So there is some controversial areas where the medicine that I know, infectious disease, and the way I know we approach diagnosing Lyme disease, we stop at some point in time and we cannot offer them, like, for example, for lack of a better analogy, like COVID. I mean, there is what is called a long COVID. Nobody knows what this long COVID is, but they are symptomatic. They have symptoms which the medical community tries to address, but they don't have an exact etiology for this long COVID syndrome, but they're still in the experimental phase. So Lyme, again, there are different stages of Lyme, the early disseminated Lyme, and then the long Lyme, and then even after post-infectious, I mean, when you treat this appropriately, but then you still can have symptoms of the Lyme disease that linger on for a long time. So that's when the traditional medicine, we don't have much to offer, but then there are other physicians, providers who go and they're treating with different things, I mean, infusions, multiple course of antibiotics, because based on traditional microbiology, the Lyme agent is only susceptible to certain antibiotics, but other providers, physicians in different parts of the country provide antibiotics which have no correlation to Lyme at all. So I know Mike Keyhart from many years ago. He's the lawyer for the Indicated Memorial Hospital, not that I had a brush with the law during that time. I know him because he used to seek my opinion about certain things that his physicians did or did not do, so that's how I knew Mike then. Again, yes, there are controversies in Lyme. Yeah, we do, not everybody's familiar. I have to agree with you. Not everybody, not a general practitioner is not familiar. Even some of the infectious disease physicians are not familiar with Lyme because they have not worked with Lyme. So if I did not.
Do you think what the Key Hearts have offered, they've offered to pay to send a physician from Macon County to this? I don't know anything about this facility in Philadelphia, but they seem to have really done their homework. When they came in, they seem to be knowledgeable about it. Is this of a benefit for the citizens of the county to have a physician that would be willing to make the time to go to this training specifically? Because they said they would pay for the whole thing.
Yeah, Jeff talked to me yesterday a little bit about Ms. Keyhart being on TV. I have not watched the episode of whatever the news item was about Lyme. But I don't know what this training involves, so I wouldn't be able to comment unless I know what this training workshop.
Yeah, she didn't get a lot of specifics on it.
If I get some more information, even about the institute that's offering this training, I can look it up and then we can talk more about it.
Okay.
Yeah, we would love for you to.
It'd be great to get someone from Macon County to go if it's.
It really would be, and, you know, because like I said, anyone who could add to his information, have two people who can communicate, talk, that's a big deal. It's a big deal. And I guarantee you, anyone who's been through Lyme like I have, they've done a lot of research, just like you have.
Yeah, it was pretty obvious in the
And
conversation.
I guarantee you, they looked into a lot of it, just like I did when I did mine. So.
Yeah,
I think it's a
that.
legit program, but like I said, give him the information and let him look at it, and I think it's a great idea.
Okay.
So I did talk with Ms. Keyhart about a week ago and, you know, just told her that we would discuss this at the upcoming Board of Health meeting, and her offer, of course, is very generous, but so what she wants to offer is to pay for the actual class. And I believe it's in Philadelphia, and then she would want or requesting that the health department would pay for the travel and lodging. So I think, you know, obviously, if we can get there and figure out some of those details, it would be a great thing. I mean, I completely agree to bring it, you know, some more Lyme-specific training for physicians in Macon County, but that's just something else to consider.
But I agree with Dr. Manigotti. I think getting more specifics on the program, who's presenting it, you know, to make sure there's validity to it.
Something else to consider is that, you know, we have two infectious disease doctors that are currently in town. You have Dr. O'Keefe, who's now serving at DMH, and you have Dr. Modi, who serves at St. Mary's. So to me, infectious disease would be the right realm of physician world to take this in. So you would want to consider approaching the hospital as well, because, you know, they're licensed under those particular hospitals. Perhaps they want to, you know, provide some assistance with travel, lodging, training, things like that. So maybe picking which one of those two is appropriate and then talking to the CEO of that hospital would be helpful. Something else that I wanted to bring up related to Lyme that I think is a need for Macon County is we do not currently have any sort of a tick drag service. So as you guys have heard in the past, we work very closely with Macon Mosquito Abatement District. We do tire drives with them. We do have a small grant for vector related needs, and we use that money to help them buy larvicide and to help with the tire drive and to also pay for a little bit of staff needs as well. What we don't have the funding for is tick drags, and neither does Macon Mosquito Abatement District. And so what that enables them to do is, just like they do with mosquitoes, capture a bunch of ticks and test them. So I did catch when I listened back to what she said that right now it says, you know, there are certain things that are not detected in Macon County. Well, the reasons why you're seeing the non-detected is because there's no testing, because we're not tick dragging. So I think that would be a really good starting point. I don't know how to make that happen. I know Macon Mosquito, Jason Probus is great. He has a lot of knowledge. He just doesn't have the funding. And our grant doesn't have enough funding to provide that either.
Yeah.
So.
And I'll piggyback on that. I just took the survey for our vector control grant asking us if we had the staff to be able to do tick dragging, and we don't have the staff for that. So that was basically the only question is, would you have the staff to be able to do this? So that's something that, Rachel and I can reach out to, who's that, Samantha?
For him.
For
Which one?
Vector.
Yeah, I feel like
Samantha.
Jason would have the staff, but he doesn't have the funds.
So we could reach out to Samantha and see if there's maybe any extra funds if we redid our grant, or our new grant's coming due soon, to where maybe we can ask for more funds in Vector to be able to support, the drags. So I mean, just a couple different ideas to go with what she was saying.
Any idea on what the approximate cost of an effective tick drag would cost?
No, but I will find out.
I mean,
If you want, I've got the contact information for the lady over at U of I that is in charge of all of the tick programs, and she is absolutely phenomenal to come speak. If you guys want, I can see if maybe she can come speak to kind of give you an idea of her process, because she's over the tick dragging. She's done a lot of these programs. Kind of give you guys a little bit more information. I can reach out to Holly if you'd like.
What do they do?
So they basically take like a white sheet, and they literally kind of, I don't know if anybody went like seining out in creeks with the nets. They basically do that through the woods, and then they look to see what's on the sheets, and if they're ticks, they collect them and then they test them.
It's usually the black leg tick that's transmits the pathogen that causes Lyme disease. And it's been, Illinois State has been positive, although the single positivity in Illinois State is not as high as in Minnesota, Wisconsin, and all over the Midwest. If you go northeast, it's a whole belt. I mean, all the way to Pennsylvania, New York, going up north to Maine, and going down to Maryland, south. That's a hotbed for Lyme disease, of course, not to mention Connecticut. So the amount of positivity is not as high as Minnesota, Wisconsin, the Midwest, but it's there. I mean, it's not, I'm not downplaying it completely. And again, when this tick feeds on the animal and gets a blood meal, and then it's so heavy, it falls down to the bushes or the leaves that are in the woods. So it's sometimes difficult. I don't know which is difficult to catch the mosquitoes in the abatement with the mosquitoes or the ticks, because they are down in the ground. I mean, and when they do this paper cloth, I mean, then when they're falling down and they're catching the ticks, and that's how they trace these ticks and test them for positivity. So it's not an easy job to try to trace these ticks and everything.
Probably not a really effective analysis.
yeah, I have a question for you. Do you think that their incidence is higher because they're more sophisticated in their collection processes?
Wait.
In like Pennsylvania
No,
and Wisconsin and Minnesota?
No, I don't
Because
think it's.
I don't know that there's a lot of difference in the weather between here and
That
Wisconsin.
may not be true, but again, it depends on the woods, and I'm not too much into that, but it depends on what the topography is there. But traditionally, it has been reported higher in Minnesota and Wisconsin.
Yeah.
Even back in Illinois, when somebody comes with me with a positive test, that's why they send it to me, and then I usually ask them in the travel history. That's part of our infectious disease history when we talk to the patient. So we talk about going down in Illinois, being out in the woods, but we also traditionally ask, have you been to Minnesota or Wisconsin?
Especially if they're deer hunting.
Or definitely northeast, and then those are the things that we know.
To expand upon what you were saying, though, the thing is, like I said, even though I have it, I was never aware of it, because I was never reported in Illinois that I had it, because
No,
I
they
got
don't.
treatment from other places. So again, back to your point, if, just because we're not a hotbed,
Right.
if people are not aware that it's going on,
No.
actually the number of cases, the number of people that reach out to me in this area has just expanded immensely in the last
No.
5 to 10 years.
Traditionally, all the
What people
entire
asked me
nation-
about and reached out and said, what did you do, Brett? What did you do to get this stuff done? So I've been helping them do that stuff, and even though they're not going through the doctors to get registered that they have it here, it's going on.
Yeah, I have to agree with that, because traditionally, the entire nation, if you take the entire nation, there has been, according to CDC, there has been definitely a significant increase over the years with Lyme disease. But having said that, there is a lot of underreporting. There's still a lot of underreporting. So what CDC dishes out there is not exactly the problem. The problem is much more. So a lot of people don't report sometimes. I mean, not every hospital lab reports a positive test to, well, it should go to the CDC. I mean, it depends on the individual hospitals, how they report their infectious diseases like HIV, Lyme disease, which are reportable. Not everybody does. I mean, so even as physicians and providers, sometimes there are certain cases that I see, other than Lyme, which are really, I mean, very unique cases, but we don't document that. I don't have time to report that or write in a journal because, so those things go unreported, undocumented.
I thought it was really interesting. They talk about, a lot of people get it, they don't realize that they had it because the timeline between, getting tick bite and then down the road finding out they've got this. I mean, I got ticks when I was a kid and my mom's a nurse. I can tell you what she did. She put Vaseline on or got a match and, whatever. And you're out camping, you're out in the woods messing around and got a tick in you, took it out and that was the end of it. You never thought about it again.
And also Mark, the initial presenting illness is like a flu-like illness. The only thing it happens in summer months, that's a different story. But it could be any flu, like, I just have a flu, that's about it. And then people don't think about Lyme disease.
Right, and that's like I said, there's a lot of it goes unreported because people don't make that connection.
Now, I just have a question for you. On our boards, they test us on Lyme disease, and they say that the average time from probably contraction to diagnosis is about 3.5 years.
Yes.
Is that accurate?
Maybe that's stretching it too far, but definitely there is a delay in diagnosis, that's for sure. Because one has to have the mindset of thinking about these things. Given for that matter, any diagnosis, any disease process, I have to have that at the back of my mind to think about it and then talk to the patient and then realize that this patient may be having this particular problem. If I don't think about it, if I don't have it at the back of my mind, I don't even consider that as a diagnosis.
Right. We had a nurse that I worked with regularly who after about 1.5 years was finally diagnosed with Lyme's disease and then treated.
Yeah, that's quite late.
And she did well, but I mean, I was at a loss. I mean, because she presented with neurologic symptoms and a whole different variety of symptoms that, just weren't explained by anything else. And so, yeah, I think probably something that.
So let's look at the training program and
Let's
see
get
what
more
is
information on the facility and stuff, because I would like to see us pursue that if it's a worthwhile
Dr. Benegatti, do you
program
want me to
pursue.
just send you an email with the
Yeah.
information? Okay,
Okay,
Could you put me on that too, please?
yep, absolutely.
any more questions for the division reports? Karen hasn't said much.
Hold on, everybody go through your reports real quick.
Okay, moving on, employee recognitions, anniversaries, Kathy Wade, 19 years. Eddie Butcher, 18 years. Tina McKee, 9 years. Brian Wood, 7 years. Randy Crowder, 2 years. Carol Osborne, 2 years. And Lakita Ford, 1 year. So congratulations and thanks to everybody. Okay, now we get over that hump in the road of reports. Old business update from the public health administrator regarding salary assessment.
Okay, so, last month, just to refresh everyone, I presented on a company called the Economic Research Institute, and they provided me a quote of $24.89 a month, or I'm sorry, a year. Sorry, not a month, a year to use their services for a 1-year subscription to the plan to be able to go and use their database. Since then, I've spoken with the administrator in Champaign County because oftentimes Macon is compared to Champaign as far as the size and the amount of employees, the programming. And they actually guided me to a different option as well, just something else to consider. Let me find my paper. It's a company that is called CLA, and it just stands for Clifton Larson Allen. And the individual I spoke to, his name was Ian, and he's been in compensation consulting for 18 years. And so he is very experienced with doing salary assessments for different agencies. He's done quite a few for public health agencies in the state of Illinois and outside of Illinois. And why I kind of was looking in his direction instead of initially just doing some kind of program like PayScale, Salary.com, all these different things that I go in and just type in the job description. I think the benefit to going through him is, one, the feedback from Champaign County was excellent regarding the results of the study. He goes in and fine-tooth combs every single job description based on the job description, what the employee is doing, and provides his results based on that. He also has access to all of those databases, economic research, pay scale, salaries, so, paying that amount a year is kind of included in the amount that he would charge us to complete the salary assessment. In complete honesty and transparency, I would love to have a professional who does this for a living. I'm, happy to go in and try to do my due diligence to research our job titles and make sure that, I'm reporting back accurate information to the board, but ultimately, I think a professional going in and doing this would be much better. Especially given, that he's done a lot of health departments and going in and actually looking at the job description and figuring out what he would recommend the salary to be based on those job descriptions. I am currently waiting on a quote from him, so unfortunately I don't have a quote to provide tonight. I spoke with him at the beginning of last week and, he did say he would get the quote to me in the next week or so. So I expect to get that in the near future and can provide that number at the next Board of Health meeting.
I think from a timing standpoint, it would be extremely important because we're gonna start talking really soon about working on budget and finance, and these pieces of information would be really valuable as we're looking at things going forward, planning the budget.
Lindsay, when you talk with him about getting that, would he also help us with a wage structure within the job description? Am I making sense? Do you know what I'm saying? Like, a range. That's what I'd like, his feedback on range versus
just one concrete.
a stopping point and then bonus check versus, you know what I'm saying?
Yep, so his, you can, add on the feature of having kind of like a low, median, and high range of pay for each position, which of course would kind of provide the range within itself. And then, the health department would of course have the discrepancy to choose based on the number of years they've been employed, the quality of their work, their eval results to determine which category they would fall in. So I think it just gives us the opportunity to look at our salaries a little more constructive rather than, assigning this kind of concrete number to so many positions. I was really impressed with this conversation. They're a company that's very well established, and again, that's his full-time job, is to do these compensation studies and, make recommendations. So that's kind of where I'm at with that. Is my personal preference would be to use an actual individual rather than just an online program that I would be using. Because I would feel much more reassured at the end of the day that there was a person going through our job descriptions rather than just typing some names into an online database.
Punching something in.
Well, I just don't know if that's the answer.
I would too, because I believe that it makes it more objective in that this individual is not employed by the health department. And I like the idea of an outside agency coming in, and because then I think there's no question that there was any bias when you were forming these. So that's my personal.
When you talk to them, and you're waiting to obviously get a quote from him, I'd be curious to know what kind of timeline it would take him to complete this process. So we got something to kind of look forward to as we start talking about
working on budget, finance and stuff, you know, that we've got some numbers within a time frame to plug into, to take into account, because that's, I mean, if he says it's gonna take him 6 months, it's not really gonna help us when we're trying to plan budget
Well, it
for next
won't help
year.
us for this year, but.
No, but
I
I'm
mean,
saying,
yeah.
I'd like to try to get something in front of me.
He stated it would take him about a month.
Okay,
So from the time that we, establish and sign a contract with him, he would have our results back within a month. He said it took him
That's
2.5
reasonable.
weeks for Champagne, but, he gives himself a month for.
And Champagne loves him.
They had really, really good feedback on him. I spoke with their administrator in person, and then we've, communicated back and forth on it via email, and, she just highly recommends him. And she's a administrator for a very long time, 20 plus years, I think. So, I really respected her opinion, and, I do just believe that it will be more expensive. I will say that than, the annual $2,489 that we would pay for this monthly subscription to Economic Research Institute. If I had to estimate based on Champagne's and what they paid, I would say that it's probably closer to $15,000 to have the entire study completed.
did she indicate a price to you that they spent?
She did, and I can share that if you want me to.
Sure.
So they budgeted, they budgeted 50,000 for the total compensation analysis, and it came in at 24,000. They do have more job descriptions than we have. And the way I understand it is that he charges by the job description. So I provided him that information of the number of unique job descriptions that we have, whether they're full-time or part-time doesn't necessarily matter. He's just looking at the job description. So I've given him that amount, and he, in casual conversation, not in written form, told me that it would probably be about 15,000.
Okay.
So just to give you guys an idea of what that would cost, leading up to getting a final bid from him. Kind of what
Well,
we're looking at.
and correct me if I'm wrong, because we only went through this once that I recall at CHIC, but the person that did it led us to believe that this would be about an every 5-year thing that needed to occur. Did he make any mention of frequency of revisiting?
He didn't, but I can definitely ask him, basically like how often he would recommend,
Right.
Redoing.
Yeah, and maybe ask Champagne if they've redone it.
Okay.
Too.
For a while, it's gonna depend on if you have
Well,
a
you're,
shakeup in your classifications to be part of it, but you also got
you've got,
time,
and you've got inflation.
right,
and-
that's what I mean,
yeah,
time
exactly.
impacts it,
Yeah, so that's kind of where I'm at with that.
Good work.
Just trying to look at, there's a ton of options out there. But I would just love the opportunity to have a person to speak to and bounce thoughts off of.
I think it
versus
makes more
just
sense.
typing
It might feel
things into a search
money well
engine.
spent.
And that's a great point as well, that I don't want to be biased. I'd rather get the results from a professional,
Nobody has any
yeah.
concern. Yeah.
If there was, and then also something else he said to me, just to give you an idea of the way he approaches this, is he's looking at job description first and then performance. So of course, that would come down to speaking with each of the division directors to determine each employee's performance. And then how long they've been employed. So first and foremost is what are they doing on a daily basis? How well are they doing it? And then how long have they been employed in the position? So there's a couple different factors that he takes into consideration and, bases his results on each of those.
So as he's doing that, he's placing them within the category of low, medium, high, is that what you're saying?
So that would be our responsibility to use the kind of guidelines that he would provide to then place them in the low, medium, or high category. But he would outline.
To get them started,
Yes, at X amount of years. He wouldn't necessarily go in and ask, how long has this employee been employed? he would say at X amount of years of employment, you would place them in this category if they had
If they're
an
job.
acceptable performance.
Okay.
So most of the work would be done on his end, but some of it would be, the final steps of it would be completed internally.
And would give us guidelines for new careers.
Yes, yes.
Okay, thank you for that, Lindsay. Okay, discussion action regarding update to bylaws related to consent agenda. Everybody should have a copy of this. I know we've been talking about this. I wish Mr. Bagley was here to make sure that we've got this. If this is the final version, this is where we're at. I mean, it appears by the document. He's gave us a finalized thing here for consideration to vote on. So open it up for questions or discussions and whether or not the consensus of the board is to move forward with voting on this tonight or not.
He thinks that's what he believes is the final option on all four.
I mean, we went through it last month and he had some things in there and that's why he, went back and revisited. I guess, how long has the county board been using consent calendar now? It's relatively new, and
I think just since the beginning of the year.
are you seeing any benefit by doing it?
Speeds things up. Cleans up the meeting a little bit.
I guess my only consideration that I have about doing this, I'm somewhat hesitant to go forward with this just because I guess my concern is everybody looks at everything that's in the agenda and all of a sudden you've got something in there that you want to separate out, you want to do something, and she's got something and he's got something. Before you know it, you're taking the consent calendar, you're pulling it apart and you're pulling items back out. I mean, just like tonight, I mean, here we are, we got directors here and we just had a 15, 20-minute conversation about a variety of topics that they, provided some information to, and I feel like I want to be expedient and use our time, but at the same time, I don't want to short circuit the dialogue with staff and also feel like the board is getting satisfaction about getting their questions answered. And so I think part of our responsibility as board members is to ask questions and make sure that we're getting information, making informed decisions. My fear with this, because the health department is a little bit more unique than what the county board is, because county board, you've got, and by extension, you have a variety of committees there. You've got your EHW, you got your finance committee, and on down the road. Those committees are made up by a percentage of board members that are actively doing regular meetings every month. So when that committee, whether it be EHW or whoever, comes to the board and they say, we've got this is what we've got, then people on the board are pretty much in the loop from an informational standpoint. So there's not a lot of, from going to county board meetings, that's my impression, that they've got the information, the conversation's already taken place at the committee level. That's where the work gets done. And I think we're in a little bit different situation here because we don't have those types of committees actively meet on a regular basis. So I'm somewhat hesitant to sign on for this myself. I think we're going to do this and we're going to come back and start ripping it apart before you know it. It's like, okay, what's on the consent calendar and what's not, and now it's going to change every meeting. And I'm more than glad to hear anybody else's thoughts on it. That's just me personally. I like to go through the agenda because just like tonight, all of a sudden we had a more extensive conversation about the question about the Lyme disease situation stuff. That's not something that you might not cover if you put all the department stuff that's under the consent calendar. Then it's like, okay, we approve the consent calendar. And you just blow right through everything. That's just me. Yes, Ms. Wade.
So I guess with me being here for as many years as I have been and been through multiple boards, I think the one thing that we've always tried to do is to try and be as transparent as we can when it comes to what we're discussing and with the community. And I think when you go to this consent agenda, you lose that transparency. That's just my 2 cents.
I would somewhat agree with you to a certain extent. I like to have the dialogue because having you guys here is really helpful, because if we haven't had a one-on-one conversation prior to a meeting, because I see something in the agenda and I have a specific thing, I may reach out to an individual and say, hey, I'd like to know about this, so that way I know before the meeting. But you're thinking something totally different on the same subject. You bring up something, you say, hey, what about this? And I'm like, well, gosh, I never even thought about that. We're still talking about the same thing, but if we just rubber stamp this, I guess is what I'm saying, and move on for the interest of time.
Well, and what's unique about and correct me if I'm wrong, because I haven't been to that many county board meetings, but you all do some legwork in committees prior to each meeting. So you sort of dissect issues before the meeting ever happens, don't you? Yeah.
That's what I'm taking away from it.
Yeah, okay.
They are working committees and.
Yeah.
And they're
Yeah,
a subset of the whole county.
yeah. So that's what makes yours kind of go fast, because y'all have already, like you said, thought about it.
Whether it's a resolution or anything, I mean, stuff comes before the county board, it's pretty much, guys vote on it, it's pretty much cut and dry.
Did that activity come when you went to the consent calendar, or you'd always done it that way?
That's always been the case. In fact, just as of this last change, some of the committees were eliminated. A little bit smaller, they're condensed because there's not as many people.
Right.
So there weren't enough people to cover. But I agree. If anything, I think this might need to be modified a little bit so that there is some more illumination of some of the different areas. I don't like the fact that we would put the division reports
As part of
the consent calendar. So to a lot of comments, first and foremost, I think that would want to be split out of there.
I don't know, barely so not, but when you all prepared the meeting, you got it, and had your ideas, which you asked questions about before the meeting happened, that's when you just pull it and discuss it. All you have to have is one board member say they want to talk about it.
Yep.
And that comes out.
Yep.
So you still have opportunity.
It's still there.
Prepared ahead of time for the meeting to ask those questions at that time, so.
And you're a seasoned veteran. What do you've been in?
I'm okay with not doing it, I mean, but not doing this, I'm okay with that. A lot of times we almost act like that, we don't want to approve the division reports anyway, that's up to us to ask the questions of the division reports. Yeah, anyway, so we kind of act that way anyway, you still through the agenda. So
I'm gonna make a motion to table this till next month and have
Talk it
a
out
little bit further discussion.
with Mike.
Hopefully some of our other board members will be here and talk with Mike about a little bit more detail, because I'm not sure this is really the direction that we really should be going right now. So I'm gonna make that motion to table it.
there's another thought that since a lot of people are so new, having a discussion of the house.
Second.
Okay, all those in favor of tabling this motion?
Aye.
Any opposed? Okay. Motion will be tabled till next month.
Who seconded that?
Dr.
Thank you,
Smith
Dr.
did. Okay, discussion and action regarding on-site deputies. I know Lindsay has had some correspondence with the sheriff's office. I personally talked with the sheriff about this in somewhat of a detail, so I'll share my conversation with him about this. He said because the health department is part of the county, it's a little bit different than just doing a hire back like they would do for a private entity. And so there's certain rules they have to follow. They basically have to pay these officers time and a half. His recommendation was twofold. Number one,
look at the hours of operation and cut the hours back, because if we just cut, I mean, I did the math, if we just cut 1 or 2 hours a day out of services being provided, it doesn't sound like a whole lot, but it'd save us $500 a week. So you multiply that over the time over the course of the year, that's a pretty significant amount of money. But his thing was, he says, a month-to-month agreement to begin with, subject to the pleasure of the health department. So he said his recommendation was to ask staff, what is your guys' greatest needs from a time standpoint? He said you could make it seasonal.
We did that.
You could do whatever
We
you
did
want to do. But he says you could say summer months, hey, we're gonna have people there from 10 to 4, but in the winter months, because we talked about the whole thing of safety and security standpoint, staff leaving in the evening, I think, is at higher risk. So then maybe in the winter time, you say, hey, we need people there from 10 to 5 or whatever. So you tell me when you guys got the most amount of traffic going through here that you think you need to have that.
Do you want me to
That layer
take it
of
or do you want
protection.
to?
I can explain on this one. So previously, we've been having sheriffs here from 7 to 4:30, which was 9.5 hours a day. And we would be suggesting decreasing that to 6 hours a day, 3 in the morning, 3 in the afternoon. Over the course of a year, a 12-month year, it would, sorry, not like the end of our budget year, it would save us between $30,000 and $35,000. And currently, we have COVID funding that will take us through the end of June. And then the grant year ends in June, and so after June, we would be requesting to use health funds to cover the expenses of having them on site. I assume, because that would be an amendment to the budget, that I would need to present a resolution at the June meeting in order to make that happen. But yeah, we're suggesting 8:30 to 11:30 and 1:30 to 3:30.
1:30 to 4:30.
1:30 to 4:30, I'm sorry,
How do they staff that? Do they just tell those people to?
to sign up,
They
is
sign
my
up.
understanding.
So, yeah, they do a sign-up sheet basically, so that,
But
and
you don't have a consecutive 8-hour day?
no, so we, one thing that we talked about when we went to this, and I say we, when I talked to the sheriff's department about this, is we're also going into a summer months now. So a lot of these deputies have families and will be taking time off for their own vacations. So we may not see a true, how the staffing will really work for these 3-hour shifts, because they may not be wanting anything because they're on vacation. The other thought was we have a lot of our third shift deputies who leave the third shift and just come here at 7 in the morning. Well, now that we're not gonna start until 8:30, they may just go home and go back to bed. So we were going to try it out for a few months to see how this works, but keep in mind that we've got, we have summer hours where they may not be wanting the extra hours anyways, because they want to spend the time with their families.
But Sheriff Root can accommodate those hours.
I'm not sure if they're gonna be able to
I don't know.
break the gap in the.
Yeah.
Well, and so we do have, they already have a sign-up sheet for June. Whether or not any of those have been filled, I don't know yet, but we did, I did tell them to go ahead and at least get it up, just so we can, if we can get deputies here, we still wanted them here. I don't know if anything's been filled yet or not.
And they're coming by sign up now anyway, right?
Correct.
So you're
And a lot
not
of times there's more than
guaranteed.
one in a day to speak to the break.
Yeah, so we normally have one in the morning and a different one in the afternoon. And then some of the ones who work the afternoon would stay late for like a Board of
So
Health
you're
meeting.
not,
but-
you at
So that
this
would-
point have never been guaranteed that
Correct.
you would definitely
Correct.
have.
And we've even had, situations where, life happens, they become ill, their spouse becomes ill, whatever, and they were scheduled to work and then they just can't show up for whatever reason. So,
But you
yeah,
don't have a gap between morning and afternoon right now, right?
No,
I think that might be where the issue might lie.
But she's getting
But
two different
she's
people.
saying they're getting 2 different people anyway.
Yeah.
So I thought it
Yeah,
might be
you
more of
gotta-
a union issue.
Yeah, you
Because
gotta get
I have
them
all kinds of rules when I call a union person.
No,
Yeah.
he said it's not. He said a lot of it is, he says people that are close to retirement or people that want to
they're
get a bump
boosting
in
their
their
retirement
salary
up.
Yeah,
and
we,
stuff because they're still getting paid through the county. So that goes into all their IMRF and everything else.
he's told me that typically the senior people will take that and
Correct, that's
bump
what
the
we're
junior
saying here.
people. And unfortunately, then we compensate at a higher
Yeah.
rate.
Well, we're paying them time and a half is what you're doing.
Well, but we're paying a senior person that at a
Right.
higher salary,
Right.
time and a half. That's some of the downfall of
Well,
us
with
doing that.
the way they got it set up, it becomes the eligibility thing, so senior people take over the juniors, that's not anything we can control.
Nope.
So, I mean, I think a 6-hour time frame every day would help out tremendously from a
So,
financial standpoint. so
We
good
did,
coverage.
we polled the supervisors with when, like when their clinic times were, when their highest traffic times would be. 8:30 to 11:30 would get us our morning clinics, the 1:30 to 4:30 would get us our afternoon clinics, plus allow our staff to get to the parking lot as the day got, as the days got darker too, till 4:30, even though we close at 4. We figured that not a lot's happening from that 7 to 8:30 in the morning. Most of us go to lunch from that 11:30 to 1 group range, so we were trying to figure out when we would have the most clientele in here. And, of course, then in the evenings for our staff, getting them to their parking or to the car station.
Similar timeline to what you have at the courthouse in terms of service.
Correct.
You have a morning session, you have an afternoon session, you got that 2-hour gap in the middle of the day.
Correct.
So,
It makes sense,
Lindsay,
it makes sense to do that.
if that saves us 35,000, what did we project it to be without the reduced hours?
It was a little over $100,000.
That's what I thought it was, that was my memory, but I.
105, 110, I think is what it was.
So, like, you're taking what they make, and based on who the salary today, so 30, they were in 60 every pay period. And then times 26 days. So, like, for what I'm coming up with, and Lakia, feel free to check my math, is 819, for an annual cost.
Then of course, they would be less than that because we're halfway through. So about half of that.
I was just trying to get the difference between the full number and the reduced number.
You mean the original number?
Yeah.
With the 9 hours?
Yeah, I'm pretty sure,
Original
I'm
was at
pretty sure.
116.
Yeah, I don't.
It reduced it pretty substantially,
They work
And we
at a
reduce it
stretch
by
now from
35.
7 to 3.
about, yeah.
I'm sorry,
They work at a stretch from 7 to 3 now,
working 7 to 4:30, I believe.
no break in between.
Well, it's normally 2 officers, one from like
But-
7 to 12 and then 12 to
As far as payment is
4:30.
concerned, you pay from 7 to 4:30.
Yep.
Thank you.
As far as cost goes, are we just using sheriff's department with the police department, Decatur Police Department?
You'll never get that.
So
They're
we-
short-staffed as it is.
We asked that when we first started bringing the deputies in, and we were told that because we are a county agency, that DPD would not allow their hire back here. Now, I know like the public library, they have both, they have DPD and MSO. But for us, there was a big to-do because we're county.
Yeah, and the civic center, you go to civic center,
Then we
city
have-
offices on any given day, you might see a city officer in there, you might see a county deputy.
Yep.
This is gonna sound kind of silly, but I'm gonna ask it. What if we had a position that we had our own?
We researched that a lot.
Yeah, we researched it
Yeah,
before.
we've spent hours talking about it at meetings, but you get, the reduction in cost doesn't benefit you because you lose a lot of service. You lose the tie to the police department, you lose the training of the person. And for the reduced cost, it really, if something critical happened, it's not a good value. Because we talked about a retired or a security company.
I was thinking more along the lines of, we get a deputy that we pay their salary. They're still an employee of the county, but we budget for their salary at straight time. Do you understand what I'm saying? Is
We had that discussion too.
Okay.
And I don't remember the specifics of it, but this was kind of the most recommended and best way is Mr.
It's kind of an odd
explained.
situation because like at the county building, for example, they could have the deputy there more often than not, it's court officers, which I don't know, is kind of strange because the county building doesn't have anything to do with the courts per se, but they utilize a lot of court officers for that position as well. And we talked about that. I even talked with him about that again when we had this conversation. He said they can't, because it's just kind of, it's a different set of the court, really don't have the jurisdiction to be able to come out here and do that. And that's how we could get somebody at a reduced rate.
So that deputy that sits at Josh Tanner's
That's what I'm
building,
talking about, yeah.
Troy Tate,
that's his job, right?
yes.
So why can't we have the same consideration that building has?
Good
I'm sure they're not paying time and a half for him to
No,
sit
I'm
there.
sure not.
We had that discussion, and if we want to reopen it, we can ask him again. I don't remember the specifics, but we asked that was,
Ask it of the county board.
we asked Sheriff Reed. We asked all of those questions, but we could reapproach it and reopen it back.
It's a weird thing
That was over a
because
year ago.
it's all county offices, whereas this is kind of its own little separate entity. From a taxing body standpoint, I know it doesn't make a whole lot of sense, but the way it's structured right now, that's what we got. But, I think
It
going
does kind of
forward,
appear that-
this at least is a good start.
Lindsay's reduced hours are probably the most cost
That
effective
would
way
be
to do it.
great, yeah.
Yeah.
So those are good questions though, like, I have the same thoughts.
And Jim said we could change it, it's a month-to-month agreement, so he says, you want to modify it at any time, he said you can do it, as
Well, if we're just
long as you don't
dependent,
change it every
if
week.
we're dependent on basically getting anybody who's gonna choose to sign up and it's not really their job, then if we start talking about giving straight time versus overtime, I'm sure no one will sign up. So that's why I'm just wondering, why don't we have our own employee?
Well,
that is-
part of the problem too, is, as Jeff was talking about too, part of the problem is too, if we went, unless, there was some kind of an intergovernmental agreement, anybody you bring in here doesn't have the same authority, like i.e.
No, I mean, a deputy. I
Right,
mean, an actual Macon County, but their job is here. Like, their job is at the school, because we have.
I'll be glad to ask
I mean,
you a
I'm
question,
just
and see.
curious, because we have police officers at the school now, they're not county, I think he's.
I mean, the good thing about doing the shorter hours and doing separate shifts that are consecutive, is you may actually get more guys want to do it, because I can't imagine coming here and sitting for 8 to 9 hours a day. Not that I don't like the people here, but quite frankly, I would be bored out of my mind.
I understand.
Yeah, so I
That's
mean,
what Troy does.
and that's what you got. So some guys just out of that alone say, you know what? I really don't want to do that.
We're a pretty
I wanna
fun
be-
bunch,
I wanna be
so
active,
they're knocking the
be
doors down to
mobile
get
and
to us.
Moving around, that type of thing. So it may be actually easier to get people to say, hey, I'll sign up, I'll work Monday here in the morning, and over here I'll work Wednesday afternoon. So you may actually get more deputies that want to do that, because it's not a bigger time commitment.
We'll have to
Yeah.
see. How long have they had that new schedule?
I just gave it to him last week, and he just put it up for June.
Maybe we could check in 10 days or 14 and just see what.
Yeah, and I saw him at the LEPC meeting this morning, and we're making a couple of changes besides the hours too, and so he asked, how it was going. I'm like, I'll let you know, got the board meeting tonight, so he's anxiously awaiting too.
Okay,
And how are we gonna fund that for the remainder of the year? Did we have,
We have funds from the COVID grant through the end of June, and then it would come from the health fund, through the end of November.
So we'll have to do a resolution.
Yes.
Yes,
so
and then,
we did
so we need to have
budget
some kind
something.
we need to have some kind of budgetary number by next month then.
It's not saying the budget came from code before, the code was paid for.
Yeah, but I remember having this discussion last year, and I thought we plugged a number in. And you obviously and we didn't do that, because we knew we would have the remainder of the year to, but I don't recall the details.
We
I'm
did
kind of,
the-
you're kind of just on the reserve. That's not something.
Maybe we just figured we would make it happen or something.
Well, we might have budgeted for it, but we may not have looked at where the money was coming from to fund it. It may still got plugged into the budget, even though it's being paid for through a grant, like anything else.
No, they should have, yeah, they should have figured whatever it was for it, otherwise it would have looked like it came up on, grants couldn't afford it.
Yeah.
Okay, so the thing is, when I got all this thing, a lot of stuff still says proposed on it. So I'm kind of unsure as if it was set in stone. However, on the most recent proposed one from last year, there was a number in there. But I didn't want to tell you that number and it not be the actual final one. But I'll let you know for sure by the next meeting. But I feel like they did put it in there.
So
It's just the fact that everything is still labeled as tentative or proposed, and they didn't give me a set in stone, this is what all the numbers were.
gotcha.
If
So,
it is,
but I think it was, I'm
Okay,
hoping
good.
that it was.
And if not, we'll come back with a number
Right,
next
and if
month
not,
that we
then,
need to
yeah,
vote
I'll
on.
tell you what the number should be, and we can do
Yeah.
a resolution.
Okay,
if it's what we think it is that was
Then
budgeted,
it was.
then it will be enough for the budget year.
okay,
But,
I'll let you know.
yeah.
okay, that sounds good then. All right, new business, public health administrator update.
It'll be short and sweet. We are just working on filling positions. We have a new, full-time care coordinator starting on May 30th, a full-time McD family support specialist starting May 18th, and a full-time emergency preparedness coordinator starting May 22nd. Kind of briefly discussed our radiological event training happening on May 31st. We are working on a summer appreciation event for our staff coming up in mid-June. I'm in the process of reviewing applications for the assistant public health administrator and will be completing interviews for that position in the coming weeks. And then, that was pretty much it for my update. I don't know if there's any questions about anything else going on or.
Okay. Macon County Board resolution approving increased appropriations in the FY '23 health fund budget for COVID-19 vaccination grant. That's on the very last page of your packet. And this is just a resolution to approve some funds from a grant.
Yep, additional funding that we've received for the grant that'll primarily pay for salary, purchase.
Okay. Anybody have any questions on that?
Lindsay, when you first received that grant, you were a little concerned that you may not be able to use all of the money and some might have to go back, or is that still the case?
I think there was just some concern on what the allowable expenses were, because we already had the personnel and fringes basically, allocated to a different grant that was gonna pay those employees. But ultimately, if we end up having to pay money back because we can't send it down, I think we're okay with that.
Sure.
But we have, come up with a way to spend it that's there on that second page. And Lakia, feel free to chime in if you have anything else to say on that.
Do all those numbers tally to 200 then?
Yeah.
Yes.
They do.
It was basically a matter of, what we previously had allocated for personnel and fringe, kind of maybe changing some of that up, putting this towards salary and fringe since it wasn't allowable at cost, and just trying to make the most of the funding that we've been given, even if it means kind of taking one for the other. So we have a plan, and we'll see if it, goes as.
Okay, any more questions on that? So this is just a resolution, we don't have to vote on that, this is the resolution that represents the county board, right?
Yes.
I mean, it doesn't require action from us though, right?
Nope.
Okay.
I'll take it to EHW and then the county.
Okay. All right, closed session, we have nothing for closed session.
requested,
Oh, I'm sorry.
that's okay. I was gonna request to open and close session.
Okay. So I need a motion to go to closed session.
I make that motion.
Second.